Hello, good evening, everyone, and a very warm welcome to today's Facebook Live session organized by the Endocrine Society of India. Before we begin, I would like to sincerely thank ESI for giving me this opportunity to moderate this session. I'm Dr. Varsha Kachru. I'm a consultant endocrinologist at Faridabad. The topic for today's session is obesity, hormones, and health. To discuss this topic, we have with us three distinguished experts who will help us explore these issues in a simple and in a practical way. So, we have with us Dr. Malini Ajayan, who is a consultant endocrinologist at Believers Church Medical College Hospital, Tiruvalla, Kerala. Welcome, Dr. Malini.
Thank you.
Then we have with us Dr. Santosh Kumar Singh, who is a practicing endocrinologist at Endocrine Care Center, Patna. Welcome, sir.
Welcome, Dr. Varsha.
Thank you, sir. We also have with us Dr. Tosha Chatterjee, who is an associate consultant at Department of Endocrinology and Metabolism at Narayana Health, Kolkata. Welcome, Dr. Tosha.
Thank you, ma'am. Thank you.
So, as we know, obesity has become one of the most important health challenges globally. While many people think obesity simply is because of overeating or lack of exercise, we now know that story is far more complex. So, body weight is influenced by hormonal regulation, metabolism, sleep, stress levels, genetics, and environmental factors. So, today's discussion aims to help our viewers understand how hormones influence body weight, when medical evaluation becomes necessary, and how early awareness can help prevent complications. For everyone watching us live, we would also be happy to take your questions. Please feel free to post them in the comment section. To start our discussion, Dr. Malini, I would like to begin with a question that many people struggling with weight issues often wonder about. So, does poor sleep or chronic stress contribute to obesity through hormonal changes? Dr. Malini.
Hi, I hope I'm audible.
Yeah.
My the question is a very valid question in today's scenario. When people take care of their gut health, people take care of physical activity and diet, sleep is something that is being omitted. Now, the relationship between sleep and obesity is bidirectional, and it's very valid because most studies have actually proven that obesity worsens the sleep, and basically sleep disorders worsen obesity. And it's a vicious cycle that needs to be broken at some point. I don't like to take too much time on it, but I'll just dwell on a few points as to how this bidirectional toxic relationship between obesity and sleep disorders work. So when when a person in general have a bad sleep pattern, now this bad sleep pattern, let me just quantify by saying that bad sleep pattern does not always mean that the number of hours that they sleep are less. It also means that not just the quantity, the quality of sleep also matters. So if there are recurrent interruptions, the sleeping, with hyperventilation, all those things actually matter. So when a bad sleeping pattern occurs in a patient, a lot of hormones go for a toss. And the commonest and the most important of that being cortisol. The patient, when a person does not sleep for a adequate number of hours, as stipulated by the American Academy of Sleeping Medicine, what happens is that the cortisol levels go for a toss and they increase, and that actually results in a patient whose the leptin levels of the patient actually reduces, the ghrelin level increases, and the hedonic centers in the brain, which rewards you for eating or for basically for pleasure and instant gratification, no, that kicks in. And at this point is that when the patient craves for higher carb food, higher calorie dense food, which makes them feel pleasure. So this is a direct indication as to how sleep disorders actually affect the patient's eating pattern. Another way by which this other than hormonal, there is always a psychological feeling. What happens is patients who are not sleeping properly, they must be working through the night, and this actually happens when they would snack through the night, irresponsible snacking, all of which contributes to the patient gaining weight in chronic period. It's not just a short-lived thing, doesn't really matter, but long term, if there is a sleep issue, then that actually leads to gain in weight, especially around the abdomen. So visceral fat, as we know, is extremely, now from an endocrinological point of view, it actually contributes to so many diseases, including diabetes and even malignancies. The other part of the bidirectional relationship is when the obesity worsens the sleep pattern. So as we all know, obstructive sleep apnea, obstructive hypoventilation syndrome is something that we commonly encounter in our OPD, and we commonly ask pointed questions. So the sleep quality and the sleep quantity are both very important. This in the same way, BMI, the obesity, I mean the weight, that contributing to bad sleep is also very important. So whenever we are facing a patient in the OPD, it's always important, especially for metabolic purposes. The patient may not be, maybe even lean obese, but they may have issues related to chronic stress and fatigue. So it's always important to ask the question whether they are sleeping well, whether they have daytime somnolence. As we know, about 60% of OHA patients have daytime somnolence. So that question needs to be asked. And like I said, this is a vicious cycle, and that needs to be broken at some point. And the point at which it needs to be broken is actually, there are 2 points where you break it. So the obesity, when you break that, when you in lifestyle modifications and diet and exercise along with pharmacological treatment for the same, when we give that, we are actually breaking it at that point. And when we are improving the sleep quality with, say, CPAP machines and improving sleep habits, we're breaking it at the sleep point. So in that way, this is interrelated, and that needs to be taken care of at two ends. So we can actually take the help of a pulmonary medicine specialist to help us get through that if we are not too confident in treating it ourselves.
Yes, thank you, Dr. Malini. That is a very interesting and important connection. So often people focus only on diet and exercise. So when thinking about weight loss and everything, but as you explained, sleep quality and stress hormones, they can also significantly affect many of our aspects of metabolism, such as appetite regulation and fat accumulation. So this actually highlights how obesity management requires a more holistic approach.
Absolutely, I agree. Sleep is a very important pattern to it.
Yeah. So, coming to Dr. Santosh, so many individuals say that they're following diet plans and exercising regularly, yet they find it very difficult to lose weight. So, can hormonal problems make it difficult for some people to lose weight despite diet and exercise?
Definitely, Dr. Varsa. We do know that it's not a simple issue as you started in your introduction. A lifestyle disorder linked only with the food which we are taking or the exercise which we are doing or not doing. Hormones do have a play at different aspects, as I was highlighted uh, by Dr. Malini in her talk on the implications of reduced sleep linked with reduced leptin and increased ghrelin. And we need to know when we talk of obesity, we talk of two aspects, which is one is linked with the appetite and the other with energy expenditure. And then we have the metabolic aspect. And the hormones which increase appetite, like ghrelin and all, they are upregulated because the body has a tendency to gain the weight it has reduced by any means, be it by diet and exercise or by the drugs. So these hormones which increase appetite, they are increased, and there is downregulation of the hormones which increase energy expenditure. And this occurs when you are losing any weight by any means, as I said. And the hormonal changes which I was talking about, one is the upregulation of the hormone which increases the appetite. The others linked with reduction of energy expenditure. And that is, there is downregulation of thyroid hormone signaling. There is downregulation of the sympathetic nervous system activity. And centers which are linked with appetite, the POMC, there is downregulation over there. And there is upregulation of NPY. So this whole thing is just going towards coming to the weight which we have lost. Then a very interesting aspect of insulin resistance. And we need to know, this is for all of us, insulin, when we talk of insulin resistance, we need to know that it is acting in a greater way at some places, and it is underacting at places with the utilization of glucose. So we have that problem of having a glycemic disorder. But when insulin acts at the level of the adipose tissue, the fat, it increases the fat. So conditions which increase insulin resistance some diseases like PCOS, or even the endocrine disruptors which we have in our day-to-day life, like bisphenol and all. They all lead to insulin resistance, which can impact the increased adiposity in the form of increased adipocytes. Then there is an interesting aspect of hypogonadism. When we increase weight or we have obesity, there is increased conversion of the male hormone to the female hormone. So there is downregulation of the male hormone, and this hormone is very important for weight, for utilization of glucose. So the metabolic aspects are again impaired. And similarly, in menopausal ladies, the estrogen is a hormone which again is a very metabolically active hormone. So if we are having a deficiency of that, there will be metabolic derangement, and more so in context of obesity, there will be increased truncal obesity. And this is for, again, all our for the audience. Overall obesity is definitely bad, but even worse is having truncal obesity. So in the menopausal state, where there is decrement of the estrogen, there is increased abdominal obesity, which again perpetuates this insulin resistance syndrome and makes things worse. So the hormones, as I said, linked with energy expenditure, the appetite, and the metabolic aspect linked with insulin resistance, compounded by the hypogonadal state in males and females thereof.
Thank you, sir, for explaining that very clearly. I think this is a very important point for the public to understand. Very often we find patients in our OPD, they feel frustrated despite repetitive attempts to lose weight, and they are doing all the sincere efforts since, uh, and even after then they are unable to lose weight. So, but as you mentioned, like hormonal factors, they can significantly influence our appetite, metabolism, energy expenditure. So understanding this link is quite important because it will help us in shifting the conversation from blame to better medical evaluation and support. Thank you, sir. My next question is for Dr. Tosha. Dr. Tosha, many individuals, they try multiple diets or lifestyle changes before seeking medical advice. So at what point should a person with obesity consider consulting an endocrinologist?
Right. So if a person is unable to lose excess weight despite healthy lifestyle measures like diet and exercise, or if there has been a sudden weight gain despite no significant changes in diet or activity level, they should consult an endocrinologist. Further, if there are symptoms of underlying hormonal imbalance, as Dr. Santosh mentioned, like hypothyroidism, insulin resistance, steroid excess, PCOS, or if there are weight related comorbidities like increased blood pressure, increased cholesterol, PCOS, fatty liver, then an endocrinologist opinion should be sought. And endocrinologists will be able to guide whether any hormonal imbalance is contributing to the weight gain. They'll be able to guide the dietary counseling, exercise, and if required, medical therapy that is now available.
Thank you, Dr. Tosha. So that is a very helpful guidance for our viewers because many people are actually unsure like when they actually need to seek a specialist consultation. So seeking medical advice at the right time, it can help identify hormonal or metabolic factors and provide more structured and effective treatment strategies. So, my next question is for Dr. Malini. Dr. Malini, physical activity is frequently recommended as a part of weight management strategies. So, how important is regular physical activity in maintaining hormonal balance?
So whenever we have a patient who comes to us for this kind of advice for weight loss, the two cardinal pillars that we explain to the patient is diet control and exercise. Though patients sometimes are okay with diet control due to various issues like including their jobs and as such, they find it very difficult to follow physical activity. Though we explain to them that both aerobic exercise and resistance training are both important, it's difficult to explain to them the nitty-gritties of how physical activity will improve, will help them lose weight at a faster and more healthier rate. So I'll just take a few minutes to explain how that happens. So there are physical activity is basically an overall endocrine stimulus. So as we know, our endocrine stimuli, I mean, the endocrine gland or glands in our body, they are extremely stimulus dependent, and activities, exercise, both aerobic and resistance training, depending upon the type of exercise, the duration, the patient's overall age and physical attributes, the underlying conditions, all of which will definitely contribute. So physical exercise in general is a multifactorial endocrine stimulus. Different endocrine organs, they respond differently to the physical exercise. For example, growth hormones. So when pituitary gland responds to physical exercise in a slightly dramatic way. So when there is an acute physical exercise, acute activity that you'll be doing, there is a burst of growth hormone. And this growth hormone, this usually happens about 10 to 20 minutes into the exercise. And once it starts, probably about 10 to 20 minutes, and it peaks after the exercise is almost over. This is an acute response, but the chronic response is that there's an increased IGF-1 and IGF-BP3, which ultimately leads to not just the muscle growth aspect of it, it also leads to substrate utilization, fatty acid oxidation, basically muscle building, and this happens over a prolonged period of time. So exercise needs to be done. The acute changes are there, but the chronic changes will help you build muscles over a long period of time. The second aspect of it is cortisol. Like I said, it's my favorite hormone. So cortisol, initially, it will help you to tide over the activity. So suppose if you're doing a high intensity training exercise, you will need all sorts of, you'll have to bring all the hormones you have to the table so that you can actually get over that particular period of, activity. So cortisol helps you, again, for substrate utilization, so immediate glycogenolysis. So it'll just help you tide over that particular aspect. But the thing about cortisol is that though cortisol helps you tide over that physical activity, that period of physical activity, if there's some amount of cortisol dysregulation, sometimes what happens is when some people who want to lose weight, they are chronically working out, so there's some amount of cortisol dysregulation that should not happen, but that actually results in this athlete syndromes and all for female and males. It's a different ballgame. We won't go to that. So cortisol, though it is very helpful, it needs to be exercise also needs to be moderated. And another important hormone in this regard is insulin. Now, insulin is heavily dependent. Sorry, am I audible?
A bit disturbed.
Hello, am I audible?
Your voice is cracking in between, Dr. Malini.
Okay, am I audible now?
You
Yes.
are audible, but your voice is
Am I
cracking.
visible? I'm so sorry. I'm in the hospital and there's a little bit of problem going on with the Wi-Fi. So what I was saying is that my insulin is one thing that that fluctuates really, or rather gets affected by exercise going on. There is an insulin-independent uptake of glucose. You feel that more glucose is taken into the muscle, and this glucose is utilized by the muscle, which is an insulin-independent sort of an activity. But then with chronic exercise, the insulin resistance actually drops. The insulin levels drop, the resistance drop, the sensitivity becomes too much, which becomes good. So for somebody who's struggling with insulin resistance, chronic exercise, so you have to keep working, keep exercising so that the insulin resistance actually reduces. So that is one good thing that happens. So we can explain to a pre-diabetic patient that I'm not starting you on any medicines. I'm just hoping that if you work out for a particular period of time, you prolonged workout for all your lifetime, you might be able to keep diabetes off. So this we'll have to explain. So again, the appetite related hormones, the reduce definitely improves the appetite as well. Also, last but not the least, I want to talk about the gonadal hormones. As we all know, pituitary again responds dramatically to exercise. There is an increased pituitary response in the sense that the LH pulsatility actually reduces in PCOS patients. Definitely hyperinsulinism, that is actually menstrual irregularities also becomes better. So the men usually have less when the visceral fat is actually reduced, the aromatase level drops, and for men the testosterone improves, and the spermatogenesis improves. For women, the ovulation improves, the LH instability improves, and overall insulin resistance reduces, so their menstrual irregularities become better. So, of course, we won't be able to explain all of this to the patient coming to you, but if somebody is, very hell-bent on understanding how exercise is going to help us, we can tell them these. Especially, I usually dwell on the insulin resistance part. Of course, they don't want to know about growth hormone. I talk mostly about insulin resistance and menstrual irregularities. So it's a very important aspect along with diet.
Yeah.
So I hope I was audible properly.
Yeah. Thank you, Dr. Malini. So that was very well explained, in fact. So exercise, as we know, it not only helps with energy expenditure, but as you said, like it also helps in improving insulin sensitivity and overall hormonal balance. So it is encouraging to know that even moderate and persistent physical activity, it can have meaningful benefits for metabolic health.
Okay. The word is persistent because you cannot expect short-term benefits to last. Only long-term benefits last, and for that you need to be persistent.
Yeah, definitely. Thank you, Dr. Malini. So my next question is for Dr. Santosh. So another issue we frequently encounter is misinformation about obesity. In your clinical practice, what are some of the most common myths about obesity that patients tend to believe, sir?
Very interesting aspects. Firstly, they would say that it runs in families. Very true, because there is an observation. We also know that almost 40 to 70% obesity is hereditary. So we do know that. But what they don't acknowledge is the problems of obesity. So they should know that. Whether your family members are having obesity or you are having obesity, it is detrimental. Not to go into the details of the other speakers about the unhealthy and healthy obesity or whatsoever, we'll discuss subsequently. So that is one aspect. Secondly, you also might have come across people who want their daughters at least to gain weight for marriage problems, and that's a real issue. And sometimes not knowing what's the subsequent harm that will do. In very leans, we do know have to have an optimum weight. That's okay. But in a normal weight, putting extra weight, that is definitely a problem. And then about the bariatric surgery. If you patient comes to you in that range where we know that the patient should undergo bariatric surgery, there are always apprehensions, and it's a last resort, and we have to convince very intensely about the utility and the lesser morbidity which we have in today's bariatric surgery procedures. So that's there. And then it was there even in our mind previously that it's a lifestyle disorder. And once you determine to have optimum exercise and you determine to have reduction of diet, and you will achieve that. And it is achieved to some extent, but the amount of weight which we want to reduce, it's very important to have optimum pharmacotherapy. So this lifestyle thought which we have in our mind that it can be easily done if you are wanting to do that is to some extent good, because that improves the compliance of the patient that he can do this. But there are limitations, and we need to explain up to how much it can be achieved with lifestyle modification. So these are the frequent things which we have in our day-to-day practice.
Yeah, thank you, sir, for highlighting these myths. I think many of our viewers, they actually they dwell on these misinformation, or what we call as myths about the obesity, mainly through the viral social trends and the social media influencers. So discussions like this is very important because this will help people understand that obesity, it is a complex medical condition rather than simply a matter of discipline or maybe motivation.
Dr. Barsa, if the others can share their experiences, I think it will be welcome.
Absolutely, sir.
About this myths which they encounter in their practice.
Yeah, definitely, sir. So, Dr. Malini or Dr. Tosha, would you like to add something to this?
It is actually very similar to what Sir just said. So parents are coming with their daughters. They want the daughter to gain weight. Already the daughter is in a very healthy BMI. So I have to make them understand the risks of gaining weight and the benefit of maintaining the same weight now. Right.
Yeah, thank you, Dr. Tosha. Dr. Malini, would you like to add something to this?
Sure, I just want to share my 2 bits of enlightenment. So I come from Kerala, where a lot of population, significant population, they live in the Middle East. So as we know that they shift there with the entire family. So children are exposed to high density, high calorie dense food from very small ages. So including something as simple as milk powder. So it is extremely calorie dense, dry fruits, packaged foods. And then these children, they come to us like around at 10, 11 years of age with obesity and then with acanthosis, severe acanthosis. And it is heartbreaking for us to explain to them, to a small child, that why your diet has been so bad since the time you probably stopped, you started weaning off. So it is so difficult to make. Then the parents suddenly shift the blame to the child. The child is not, accommodating. The child does not eat vegetables. It is the kind of food that they have exposed the children over the last 10, 15 years that has led to this particular, predicament. So it is heartbreaking, though we explain to the patients and the bystanders that. You have to change your diet as a whole, as a family. It cannot be that you are eating one particular food and the child gets boiled vegetables. That doesn't work. So we have to explain to them that at 20s, the girl, if it's a girl child, they may struggle with in the teens, they may struggle with PCOS and menstrual irregularities. In 20s, they may struggle with infertility. By 30s, they have established metabolic syndrome. We talk about metabolic syndrome and infertility to a 12-year-old child. It is pathetic to be to be honest, as an endocrinologist, but that is the kind of picture that we have to paint for them so that they tackle this issue as a family. I do have quite a number of alarming patients in that sense.
Right. Thank you, Dr. Malini. So that was actually very enlightening, in fact. So coming to the next question, I would like this question to ask to Dr. Tosha. Dr. Tosha, in the desire to lose weight quickly, many people attempt very restrictive or what we call as crash diets. So can crash dieting disturb hormones and worsen long-term weight control?
Right. So crash dieting, that is severely restricting the calories, actually cause rapid weight loss in a short duration of time. However, it puts the body into starvation mode. It disrupts the hormones that are supposed to regulate hunger and metabolism, like leptin, ghrelin, thyroid hormones, and it makes further weight loss very difficult. Also, when the crash dieting is stopped, then the weight is regained very easily, even sometimes more than what has been lost. It also causes muscle loss, and we know that muscle loss actually slows metabolism further. In women, it may cause menstrual irregularities, it causes nutritional deficiencies, and it increases the risk of developing gallbladder stones. So, the gradual weight loss with sustainable lifestyle choices is the safer and more sustainable way to go.
Absolutely. Thank you, Dr. Tosha. So, this is a very important point to emphasize. So, while rapid weight loss, like you just said, it is very what I can say is appealing. So, extreme dieting can sometimes disrupt hormonal balance and metabolic adaptation. So, like you said, it leads to muscle loss as well. So, making long-term weight maintenance even more challenging. So, sustainable and medically guided approaches are clearly much safer and more effective. So, my next question is for Dr. Malini. So, Dr. Malini, from a public health perspective, awareness and screening are extremely important, as we know. So, how can we improve public awareness about screening for metabolic complication in individuals with obesity?
Idea across what we are trying to achieve for the patient. So, as we all know, obesity is not just about the perspective of physical attributes. We have crossed that phase, and now we are in a phase where we are more concerned about the complications, the hidden complications that obesity poses. Previously, in the previous generation, probably it was more about physical attributes. Looking good was the primary motto. But now, as we are aware of it, it's more about the hidden complications. So, patient may be obese, but they may not have the complications as of yet. but that does not preclude them from, not having complications in the near future. And what is that near future, we do not know about, but it's our job to explain to the patient when they come to us that the threats that may be, lurking in the background, in the shadows, which it's not yet surfaced. But when we are breaking that particular news to the patient, or rather when we are explaining it to the patient, it needs to be in a very sensitive manner. Now, most patients who come to us are a little defensive because of the so-called social stigma and whatnot. With that, when we explain the complications, we do not have to pose as a, like a naysayer. We'll be telling them that, oh, you're going to have all those complications. Just break it in a very gentle and in a simple manner, that the complications that you may face in the future includes simple stuff like difficulty to, osteoarthritis, though it is not very simple though, but probably from a 30-year-old's perspective, it doesn't carry too much weightage. To diabetes, to malignancies, to atherosclerotic heart diseases, we'll have to tell them that this is your future. This is what is awaiting you in the future. But when we are saying it, it has to be in a very simple manner. We do not have to use, highly scientific terms. We just have to paint them a very simple picture. And the most important thing is that although when we have to be very sensitive about communicating this issue, we have to be firm and we have to be entirely scientifically backed, without giving any sort of judgment about the patient's lifestyle, or in passing judgments about the patient's lifestyle or current situations that they're going through, because they're already in a defensive mode, and more lectures will actually, pull them back. And that happens to adolescents mostly, not to adults that much, but adolescents, yes. And we have to explain the importance of screening programs. And by screening programs, I do not mean, huge lab investigations, scan procedures, nothing like that. I would be just doing a few basic blood investigations. I'll just tell them that small, basic, cheap investigations like HbA1c, lipid profile, fasting blood sugar. I'll just use a tape and I'll check the waist height ratio, the waist hip ratio, and a BP cuff. All of these things are, are cheap, and these are just small screening methods which will give me an idea as to when to intervene. And if that intervention point is important, that's what we have to convey, because obviously they have to agree before we give them the battery of investigations, right? And the important idea is to, like Dr. Tosha said, we'll have to identify whether it's a simple obesity caused by all these exogenous factors and endogenous genetic and epigenetic, or if there is a syndrome lurking in the background, in which case we need to identify it as soon as possible. And it's important for doctors to educate and use the community and digital media platforms to, one is to actually convey the scientifically backed information. The second thing is to thwart the myths that are, it's always in the Instagram, you'll see somebody has lost some 30 kgs, and the woman would come and say that, see, this person has lost 30 kgs, I'm only eating as much as they are eating. Now, why am I not losing weight? You'll have to thwart the myths. That's important. It's your responsibility. Sadly, we live in that digital era where we have to tell them that these things are just fake. And screening should be used as an empowerment technique, actually, not as a diagnostic technique. You have to explain to the patient that this small test I'm doing right now will save your life in the future, in the most, like I said, non-judgmental, that sort of a friendly sort of manner. So in my opinion, these are the important screening, I mean, the public health related ways by which you can tackle obesity at the index point without, worsening it.
Yeah, thank you, Dr. Malini, for a very valuable insight. So, like you said, we have to paint the picture in a very gentle and polite way, and not just lecture
Firm,
them
but
over,
firm.
but firm.
We cannot mollycoddle, so firm is also important.
Is also very important. We cannot just lecture them right away and just tell them what you have to do and what not. So we actually have to paint in a very firm and in a very polite way. So also encouraging them for regular health checkups and educating the public about risk factors and about the future complications. I suppose that can also help us in improving the long-term outcomes.
Absolutely agree.
My next question is for Dr. Santosh. So for individuals who are living with obesity, understanding their metabolic health is extremely important. So, what basic tests should a person with obesity undergo to evaluate their metabolic health?
Okay, Dr. Barsa, I would like to go a bit into detail,
Right.
and with permission of Dr. Malini. Uh, there was a very nice paper on the ICMR 23 study. And this involved patients who had BMI of less than 25 and more than 25. And along with two conditions linked with the metabolic syndrome. So that was the inclusion criteria. And this is Indian study, so I'm emphasizing on that. And in that, the non-obese category, that is BMI less than 25, with the less than 2 metabolic risk factors. And metabolic risk factors are very easy to remember for metabolic syndrome. One is dyslipidemia in the form of triglyceride more than 150, or HDL in males less than 40, in females less than 50. So that is about the dyslipidemia part. Blood pressure 130/85, or the patient taking antihypertensive, or IFG, or a diabetic patient. So that is the glycemia component. So these are the different components of metabolic syndrome, and the patient need to have two metabolic risk factors to place him under the unhealthy category. So in this, non-obese patients, what the chunk, 42% of them were non-obese with two metabolic risk factors. So even in our population who are not apparently obese, and they do have this metabolic risk,
Yes.
and that is to
And
some
the
extent
integrity.
linked with the abdominal obesity, thereof, and truncal obesity, which we will discuss again subsequently. There's another entity where only 2% of them were there, that is metabolically healthy. They had BMI of more than 25, but no metabolic risk factors. So they were healthy, but this comprises only 6 to 16%. Okay, and if you follow up, they may again go into that unhealthy category. But present day data, 6 to 16%. What I was going when talking about the problem of metabolic health, as I said, I will go a bit into the detail. And this stems from the metabolic things which I was talking about. One is triglyceride and HDL. So these are the two things we need to know in the track, along with the cholesterol. The other thing which somehow Malini didn't mention about the resistance training, and we need to remember the muscle in a greater way, because it has been seen that dynapenic obesity, where there is obesity, but there is loss of function of muscle mass, be it preserved. Sarcopenia, we all know. But even loss of function has been linked with more factors with CMM, that is cardiometabolic multiple morbidity. And that includes CAD and stroke and type 2 diabetes, all those things. And the factors which were linked with that, it included CRP and atherogenic index of plasma, which is again denoted by triglyceride and HDL. And these are studies where they have shown this association of increased CRP and atherogenic index of plasma, which is denoted by triglyceride and HDL. So coming from there, the resistance of training, and I would again to Dr. Malini, just to add, when we talk of physical activity, we all remember that 150 minutes. But activity of that sort won't do anything for obesity. If you want to maintain that, it is 200 to 300 minutes of moderate activity and half of that of vigorous activity, along with 2 days of resistance training, again pinpointing the effect on the muscle mass and proper protein intake. So that is there. So metabolic aspect, one is we need to talk about the metabolic syndrome. I was talking about glycemia. So we need to know the glycemic status and HbA1c. Okay. Second was dyslipidemia, triglyceride, HDL, and definitely LDL cholesterol. And in our population, we know the maximum of that was in triglyceride. Then came cholesterol, and then we have the low HDL part. Then the other metabolic aspects in the form of CKD. And for CKD, we need to assess the ACR, albumin creatinine ratio, and the EGFR. And for that, we need to have the serum creatinine values. Again, when we talk nowadays of multimorbidity, we talk of CKLM, cardio, kidney, liver, metabolic syndrome. From that aspect, we need to have an inkling of the SGPT, SGOT, and platelet count to calculate the FIB4, and from there go forward for proper evaluation of the MASLD or MASH. So the overall concept of the metabolic profile, and not to undermine what we term as comprehensive metabolic panel. And that includes the urine routine analysis, that hemoglobin and whatsoever. But to pinpoint on the obesity part, we need to focus on the different aspects of metabolic syndrome, and then to go for the intricacies of ApoB and lipoprotein little a. hormonal evaluation of TSH and cortisol, these are very subject specific. So we need to do this when it is required. Similarly, for the echo and the other tests for going for the body composition in the form of DEXA and all, these are specified tests. For a routine metabolic assessment, the initial thing is to have that different components of metabolic syndrome along with obesity.
Thank you, sir. That was very well explained. I do agree that we need to do this comprehensive metabolic panel. So I would also like to add one more thing. So I usually do is I also test the thyroid profile of my patients. So apart from the thing which we are doing, like the diabetes part and the screening for the metabolic complications. So because right now patients are more into the thyroid thing because of the social media influence and everything. And yes, definitely all the investigations which you said, which help us in actually understanding how the disease will actually progress and what complications patient can further see in the later lives. Uh, Now I would.
With your permission, just to add, I emphasize on this point that with the borderline elevation of TSH, you can reduce that TSH only by weight loss. Simply weight loss. So we need to emphasize that because in
Right.
today's era of TSH reporting, you might be knowing and coming across, patients are always eager to have L-thyroxine tablets. So we need to be very clear when to institute L-thyroxine therapy in an obese individual.
They also think that the weight loss won't be possible until they are started on the thyroxine tablet.
They
That's
in
true.
fact think that if somebody is like 20 kgs overweight, it is mainly because of hypothyroidism rather than the other way around.
The TSH will be 6.
Absolutely. TSH will be 6, and still they think the obesity is mainly
They're
because of
worried. Yeah, it's
simply because
5.5 and
hypothyroidism.
6.
Yeah. So now coming to Dr. Tosha. So finally, as we know, like prevention is always better than treatment. So from an endocrine perspective, why should obesity prevention begin in early childhood rather than adulthood?
Right. So childhood obesity is linked to early development of metabolic problems like dyslipidemia, hypertension, insulin resistance, fatty liver, and it also increases the likelihood that the person will be obese in adulthood as well, thus increasing the risk of cardiovascular diseases, type 2 diabetes, PCOS, and certain cancer even. So, in addition, an obese child is more prone to stigmatization by his peers, leading to low self esteem, then depression, and poorer quality of life. So, we should deal with, for the mental and physical well being, we should deal with obesity very early on, right in childhood.
Yeah, thank you, Dr. Tosha, for highlighting that. Yeah, like you said, and Dr. Malini also highlighted that childhood is a very critical period for developing lifestyle habits, and interventions right at this stage is very important. Like right now in our OPDs, we are seeing many of the children in the 6 to 10 years age group, they are coming with fatty liver and whatnot. So we have to highlight that this can have a profound impact on the long-term metabolic health. So focusing on prevention early in life can actually reduce the burden of obesity later in the adulthood. Yeah, so that is all for the questions. I would like to invite all our panelists to just share one key message for the audience regarding obesity and hormonal health. The closing message for our audience. Yeah, Dr. Malini, may I start with you?
Sure. I only have one message to give to everyone. Do not pull back. Go for help. Get help. There is a newer generation, or rather, there's a newer set of doctors who are not going to judge you for whatever that has happened in your past. We are judgment free, and all doctors have to be in a judgment free zone. So do not pull back from getting help that you deserve. Obesity is a generalized condition. Like I said, it's not always the diet and the exercise. When we look at an obese individual, the initial thing that comes to our mind is, oh, this person is lazy or this person overeats. That's not true. We know that it is scientifically backed. So get the help that you deserve, get the help today from a judgment-free doctor so that we can help you live along the better quality of life. That's the only message I have.
Yeah, definitely. I think most of the doctors right now of our age groups and in the coming trends, they are actually writing judgment-free endocrinologists. So that is a very good thing
It's
to have.
not up to us to pass judgments on anyone. So just to
Definitely.
help them. Yeah.
Yeah, definitely. Absolutely. So, Dr. Santosh sir, may I request your closing message for our viewers?
Again, emphasis on diet and exercise, vegetables, fruits should be there, and it should be from the parent side to go for a healthy diet. And I think the onus lies on the parents for children, as we just heard about the impact of obese children, almost 80% going on to develop obesity in the adulthood. So diet is one. Avoiding the ultra processed food, we need to take into account, and uh, snacks which they are having, we are well aware of. And whenever we are visiting our relatives, we go with things which we know it is detrimental for the child. Despite that, we go with sweets and chocolates and the different snacks which are there. Physical activity, again, important, and with emphasis on building the muscle mass. And in today's era, I give much importance in my clinic. I'm doing it routinely, and I do come across it in a very big way. So this thing, it can be easily done. And I ask my patient that you can do it. You have to go nowhere. You can just sit and do the muscle exercises. So this is one aspect about the diet and exercise, which I would personally emphasize upon.
Thank you, sir. That was actually a very valuable point that we have to, like, in the era of easy access to ultra processed foods. So we have to highlight patients what is important for maintaining their weight and how they have to actually preserve their muscle mass. So it's not just about the diet, like telling them diet and lifestyle. We have to mention that what foods you actually need to cut down and what uh, kind of exercise you need to like process into your daily lifestyle. Yeah. And finally, Dr. Tosha, may I get your opinion and closing off message on
My
this?
message to our viewers will be that obesity is not lack of willpower. It is not failure on your end. There are a lot of underlying factors that a doctor might help you with. So after ruling that out, we should come to diet. And obviously, as Dr. Santosh had insisted, strength training is very, very important. I feel very happy when I start my patients on strength training. Even 60-year-old, 70-year-old female, especially, it is more important for them, and they need to realize that. So yes, if you build muscle, then you tend to keep off the weight for a longer period of time, and you can eat more if you eat in a healthy way and not regain the weight back. So yes.
Yeah, definitely. So this is a very important point to highlight, that muscle strength training, it is very important, which we usually forget, or most of the physicians, they usually forget to mention. Like, it is not only about exercise or doing aerobic or cardio thing. You need to understand that muscle preservation with the increasing age, how important this muscle plays a role into your life. Yeah. So, as we conclude today's discussion, a few key messages they stand out. Like obesity, like Dr. Tosha said, it is not just a matter of like you are losing, you are having lack of willpower, or you are not having any enough efforts, or you are not sincere enough to lose weight. So, it is a basically medical condition which is influenced by multiple factors. So, multiple things like hormones, sleep, diet, exercise, your metabolism, genetics all play important role in weight regulation. So, early screening and timely medical guidance, they are essential to prevent complications. So, I would like to sincerely thank our panelists, Dr. Malini, Dr. Santosh, and Dr. Tosha, for sharing their insights. Thank you, everyone who joined us today for this informative session. Let us continue spreading awareness and encouraging healthier lifestyle for better metabolic health.
Thank you, Dr. Varsha, ma'am.
May
Thank
I,
you.
Thank you, Dr.
Varsha?
Varsha.
So I think a big hand to Varsha for the great job.
Thank you so much, sir.
Uh, And to all my panelists,
Thank you,
Safi.
sir. Thank you. Thank you, Dr. Tosha.
Uh,
Thank
okay.
you, ma'am.
Thank you.